Hi, this is Dr. Paul Reifenrath for Upper Level Canine, and today we're going to talk about common orthopedic conditions in dogs. So the next condition we'll talk about is elbow dysplasia. So this is kind of an umbrella term for several different conditions that affect the elbow joint in young patients. So the causes are multifactorial with genetic and environmental factors involved. And all these conditions will cause osteoarthritis in one or both elbows. So clinical signs usually show up as forelimb lameness, usually after exercise, pain and decreased range of motion of the elbow joints. So diagnosis is usually made by orthopedic exam and radiographs. So usually medical management is utilized first. Same procedure, same techniques that we would use for hip dysplasia. If medical management is unsuccessful, then surgical management is then recommended. And this can be done via open joint surgery or arthroscopy. And basically what you're doing is cleaning up the joint, removing bone spurs. And two of the conditions, there's going to be a little bone segment that's going to be floating around in the elbow joint, and those are typically removed. Now, unfortunately, surgery doesn't affect the progression of osteoarthritis. That's still going to be there, and it's still going to progress with time. And then osteoarthritis will need to be managed for the life of the dog. So the next condition we'll talk about is called osteochondrosis, or OCD. So OCD is a cartilage problem inside the shoulder joint. Most commonly, we see it in the shoulder joint, but we can also see it in the knee joint, in the elbow joint, and in the ankle joint. So what happens in this situation is we get a flap of cartilage that occurs, and we get kind of a divot or a defect underneath that cartilage flap. And as you can imagine, when the dog is running around, this cartilage flap is kind of flopping back and forth inside the joint, causing pain. So we tend to see forelimb lameness that comes and goes, typically worse with exercise. And usually they're very painful on range of motion, especially extension of their shoulders. Typically surgery is the best option to deal with osteochondrosis. And usually through arthroscopy or sometimes through open joint surgery, that cartilage defect, the flap is removed, and then the cartilage defect is resurfaced. And that will eventually heal in with scar cartilage and usually provide a very, very good outcome long term. If surgery is delayed or surgery is avoided for osteochondrosis, we are going to get some osteoarthritis that develops inside that joint, and we're going to have continued lameness that we're going to have to deal with as well. So medical management would be important in that case. So another condition that we see is what's called medial patellar luxation. And this is a disease of the knee joint that we tend to see in our small breed dogs, in our young small breed dogs. Occasionally we will see it in our medium to large breed dogs. So what happens in medial patellar luxation, we have a decreased angle at the level of the hip joint. So the problem is actually at the level of the hip, but it's reflected at the level of the knee joint or the stifle joint. So what happens is with that decreased angle of the hip joint, the quadriceps muscles, the big muscle group in the front of the thigh, are now displaced to the inside or medially to the inside of the leg. And this pulls the kneecap or the patella to the inside. So the kneecap lies within the tendon of the quadriceps group. So the kneecap will actually pull to the inside and kind of pop back and forth. And typically clinical signs that we see with this is a non-painful, relatively non-painful, non-weight-bearing hind limb lameness. So these dogs will be running around and all of a sudden they'll pop that back leg up in the air and they'll hold it up for a while, and you may see them kind of kick it behind them, and that pops the kneecap back into place, and then off they're running on four legs again. So we do grade this disease on a scale of 1 to 4. So grade 1 patellar luxation is very mild and typically doesn't need any interventions. Grade 2 to 3 patellar luxation may need surgical intervention depending on the clinical severity of it and how the dog is dealing with it. And grade 4 patellar luxation usually always requires surgical intervention. Because in grade 4s, the kneecap is permanently fixed outside of its normal position, and the dog's knee is in flexion, so it's unable to bear weight on the leg and unable to extend its knee. So there's various surgical techniques that are used depending on the severity of it, but basically we're trying to realign the quadriceps muscle group, and so the kneecap is tracking a normal position again. So left untreated, patellar luxation, more severe cases of patellar luxation can lead to osteoarthritis, and also can predispose dogs to cranial cruciate ligament rupture, which is what we'll discuss next. So we'll get into that. So cranial cruciate ligament disease is the most common orthopedic disease that we see in adult dogs. So this causes a gradual progressive degeneration of the cranial cruciate ligament, which is the same anatomical structure as the anterior cruciate ligament in people. And those terms can be interchanged. And this will cause instability of the stifle or the knee joint and eventually lead to progressive osteoarthritis with time. Usually what we see is, in this disease, we'll see intermittent partial tears that occur within the cranial cruciate ligament. That usually is reflected by intermittent partial weight-bearing lameness that usually comes and goes, and we'll usually see it several weeks to several months prior to a complete rupture. So it eventually, in almost all cases, those partial tears will eventually progress to a complete rupture of that cruciate ligament. And once the rupture occurs, we're going to have severe instability of that knee joint. So many breeds are affected by this. Labrador retrievers, golden retrievers, pit bulls, boxers, mastiffs, Newfoundlands are affected, and we do see a lot of mixed breeds of these breeds as well affected by this disease. There are many genetic and environmental factors that are involved with development of cranial cruciate ligament disease. Early spay and neutering and obesity tend to play a big role in certain breeds, especially Labrador retrievers. So clinical signs, usually we'll see an acute onset non-weight-bearing lameness in the hind leg, and usually that's preceded by several weeks to several months of partial weight-bearing lameness that may or may not be noticed by the owner. Some dogs can be very good at hiding that, especially if they're not real active dogs. We'll also see some joint swelling in the knee joint. We'll see pain on range of motion, and we'll see some significant muscle atrophy in the back leg, in the affected leg. So diagnosis is made by orthopedic exam, and we will check for instability of the knee joint during that exam. In some cases where we have a very anxious dog, a painful dog, or a dog that's just being uncooperative, we will recommend sedation to facilitate the orthopedic exam, and that can be very helpful to identify subtle changes in joint instability. So radiographs can be helpful in diagnosis and also very helpful with surgical planning. So how do we manage cranial cruciate ligament disease? Surgical stabilization is strongly recommended as soon as possible after diagnosis, especially in our medium to large breed dogs and giant breed dogs. So our small breed dogs, usually under 20, 25 pounds, they can do very well with medical management and time. So I usually don't recommend surgery unless we have a dog that's severely unstable or has some other complications related to the cruciate ligament disease in our small breed dogs. So we have better surgical outcomes if the surgery is performed before osteoarthritis develops. Now, unfortunately, osteoarthritis develops usually within 4 months of the initial inflammation that is occurring. So it's very common to see osteoarthritis already well established at the time of surgery. Surgery is usually needed to stabilize that stifle joint and to minimize the progression of osteoarthritis. Unfortunately, osteoarthritis is inevitable with this disease, whether you do surgery or not, but surgery can slow down and delay the progression of osteoarthritis. So another very common complication that we see with cranial cruciate ligament disease is meniscal tears. So the menisci are little cartilage plates that sit between the femur and the tibia in the knee joint, and they provide additional stability in the knee. So when we have a deficient cruciate ligament in the knee, we get a lot of sloppy instability of that knee joint, and that causes significant damage to, especially to the medial meniscus, the one on the inside of the knee. And typically meniscal tears will be identified and treated during surgery. And a lot of times what we notice with meniscal tears, you may notice a click when your dog is walking, an audible click. And that's the meniscal cartilage, the torn cartilage that's kind of flopping back and forth within the knee joint. That can be increasingly painful as well. I've had meniscal tears in both my knees. I know what they feel like, and I can sympathize with my patients. Probably the most frustrating thing that we see besides osteoarthritis with this disease is that greater than 50% of dogs with cranial cruciate ligament disease will develop cruciate ligament disease in the other leg within a year of diagnosis of the first leg. So we always recommend at the time of first diagnosis, start planning for the second surgery somewhere down the line. So that can be a very frustrating thing. I've seen it happen where the dogs will be diagnosed, come in for surgery, and while they're recovering from their first surgery, they blow the other knee out. That actually happened with my own dog several years ago. Within about 2 weeks after his surgery, he ruptured the other leg. So we had to go through that all over again. So the surgical techniques that we use for cranial cruciate ligament repairs are most commonly used as the TPLO, or the tibial plateau leveling osteotomy. So this is a procedure where the top part of the tibia is cut and it's rotated to the point where you eliminate the forces that are controlled by the cruciate ligament. So you basically eliminate the need of a cruciate ligament. Those two bone segments are then plated in place with a specialized bone plate, and healing time is usually about 8 to 12 weeks. So this procedure, we tend to have the best stability of the knee, and it tends to probably be better at decreasing the progression of osteoarthritis. It is an expensive procedure to go through, and there are quite a bit of restrictions postoperatively until they are healed. So another procedure is called the TTA, or the tibial tuberosity advancement. This is a procedure where the attachment of the patellar tendon on the front part of the tibia is repositioned. And by repositioning the patellar tendon, you're increasing the stability of the knee joint. Probably the most common procedure that's been done over the years is called the extracapsular suture stabilization. So the extracapsular repairs are using a monofilament nylon suture that attaches the femur to the knee joint. So you're eliminating the internal rotation that is happening with instability, and also the forward, what we call the drawer motion of the knee joint. This is a technically relatively easy surgery to do, so it's commonly done by general practitioners. It's best done with dogs under 75 pounds. Usually our small breed dogs and our medium-sized dogs do very, very well with this procedure. It can have some complications, and it does tend to have probably the longest healing time, because we're also waiting for the scar tissue to form along that implant to provide final stability. And that can take anywhere from 6 to 12 months to develop. So that also tends to be the most cost-effective procedure to do. So the other one that is similar to the extracapsular repair is called the tightrope CCL procedure. So this is using a specialized implant that is placed within the knee joint and can provide enhanced stability. And this can be done on large and giant breed dogs because the repair is usually very, very stable. So in general, postoperative recovery for these is usually 4 to 6 months, sometimes longer, especially extracapsular repairs take a little bit longer. And that's usually 4 to 6 months of rest, very limited leash walking activity, and some progressive exercises once they're physically able to start doing those exercises. So The most important thing with surgery is following postoperative instructions. This long-term success of surgery usually comes in the postoperative period. So as these knees are healing and we're going through the rehab process of strengthening the muscles around the knee joint, that usually provides us with our long-term success. So surgeries are expensive, and that can be a really strong incentive to follow postoperative instructions. So I have had dogs that the owners have left the dog out to chase squirrels within days of surgery, and we have problems. So I definitely recommend following instructions. And these problems can be really significant, and where they would require revision surgeries to deal with the complications. So be aware of that, take those seriously. So weight management, again, just like hip dysplasia, is extraordinarily important. We want to keep these dogs in ideal body condition and probably a little bit slightly underweight. During the postoperative period, they are very inactive. They're not burning any calories off, so we really have to feed them significantly less to prevent obesity from developing. So keep that in mind as well. If your dog is really significantly overweight at the time of diagnosis, surgery may be postponed, and dog may be put on a very strict weight reduction program. Obesity can be a really significant complicating factor in the recovery of these dogs after surgery, and they tend to do so much better if they're at normal body weights. So medical management of cruciate ligament disease is very similar to what we would do with canine hip dysplasia. So not every dog is a candidate for surgery. And some dogs, this may be due to concurrent disease, advanced age, and owner's inability to control the dog postoperatively. And also surgery can be cost prohibitive for some people. So regardless of whether surgery is done or not, medical management should be started in every dog with cranial cruciate ligament disease. The goals of medical management are to slow down the progression of osteoarthritis, eliminate the joint pain, improve joint function, maintain the muscle strength in that back leg, and eventually improve mobility, and also hopefully prevent the other leg from being affected. So similar to what we discussed with hip dysplasia, we use nonsteroidal anti-inflammatory drugs, we use joint supplements, we use stem cell therapy, we use Adequan injections, we use Librela, we use rehab therapy, we use cold laser therapy, acupuncture, also controlled exercise, and nutritional therapy is really important too. There are some prescription joint diets that are very effective at minimizing some of the inflammation that occurs inside the joint. One other thing I want to briefly discuss is orthotic braces. So you may have seen dogs wearing a brace on their knee. There's a few things that are important with braces. They should be custom fitted by a rehab specialist. So there are many companies that provide them over the internet. They are not cheap. They can be hundreds to thousands of dollars. And they have to fit perfectly. And they have to be comfortable for the dog to wear. I have seen many complications with orthotic braces, from ulcers to joint damage. And I've seen quite a few dogs actually destroy them. So if not every dog tolerates having a brace on their leg, so we have to kind of pick our patient as far as whether braces are going to be a viable option. Keep in mind, your veterinarian can certainly refer you to a rehab specialist to get custom fitted for a brace. They can be helpful if the dog tolerates it. Especially with our older patients that are probably less active, I think they can really shine in those cases. A young active lab, I wouldn't even recommend that because they would not tolerate that at all. But an older Great Dane or an older Mastiff that is a pretty lazy dog to begin with, I think they would probably do okay with a brace. Unfortunately, all these orthopedic conditions that we discussed are going to eventually end up with osteoarthritis. And osteoarthritis, again, is a lifelong disease. It progresses with time, and it can be very, very debilitating. And it can lead to other problems, especially with our dogs that have hind limb lameness, like hip dysplasia and cranial cruciate ligament disease. As they are shifting their body weight off of those back legs because they're painful, it can cause problems with the front legs. So we will commonly see osteoarthritis developing in the foot joints and the elbow joints and the wrist joints and the front legs over time with our dogs with chronic hip dysplasia and cranial cruciate ligament disease. So we have to keep that in mind. That's where weight reduction is such a huge factor at minimizing the progression of all this. Osteoarthritis too, with medical management, it's important that we do what we call multimodal management. So that's using many of these tools, not just one, but using many of these tools to manage the arthritis. And we tend to have our best outcome if we use multimodal management. So if your dog is a breed that is at risk for any of these, it's important to talk to your veterinarian at your puppy visit or annual wellness exam and see what actual risks are for your patients. But obesity is probably one of our biggest risks for these diseases. So keep that in mind, talk to your veterinarian about it, and thanks for watching, and we'll see you next time.